the multi-procedural kidney pathology Phantom and remote training platform by Viomerse, currently known as SIM. The kidney pathology Phantom simulates the left flank of a patient and includes skin, muscle, spine, ribs, kidney, with 2 tumors, upper and lower pole, ureter and hollow renal pelvis, and calyces. It allows for endoscopic and ureteral and percutaneous access. It includes a large kidney stone for lithotripsy and permits imaging with ultrasound and fluoroscopy. Potential procedures for this Phantom include ultrasound-guided renal biopsy of the tumors and pelvic access for placement of a guide wire, ureteroscopy and lithotripsy, percutaneous nephrolithotripsy, and focal kidney tumor ablation. The Phantom block is flesh-colored and has a dimension of 14 by 20.8 by 28 centimeters. The Phantom is contoured, similar to what's found in a patient. The cutaway view of the Phantom shows the 3 ribs, 10th, 11th, and 12th, the spine, and the upper portion of the pelvis. The position of the ribs allows the ultrasonographer to accurately place the probe when doing the procedure. The ultrasound image appears in the waveguide, while the lower portion is see-through, allowing him to simultaneously view his hands during the procedure. When teaching, both images, the stack view, can be viewed remotely by student for training. The student can then demonstrate the procedure back to the proctor. Grant, what's your impression?
Very cool.
And how do you like the fact that you can see the ultrasound image on top of the Phantom rather than having to look at the monitor?
No, it's great because as I'm looking at it, and I'm assuming it'll even show our biopsy lines.
Well, you've got to put it on, can you?
Right. Yep. And then I can drop my needle right here on the same without having to look up and down.
So now you can,
I can see them.
now you can imagine you're teaching somebody remotely, and they're wearing the same headset, and they got a Phantom or they got a patient,
Yep.
and you could look at their procedure and they could look at your procedure.
Game changing.
How is that image? Is that better?
Yeah.
Thank you.
The kidney Phantom ultrasounds extremely well. One can see the large upper pole tumor, a much smaller lower pole tumor, and the shadowing from the kidney stone is appreciated in the midline of the kidney. In this clip, the clinician is going to perform a percutaneous kidney biopsy and an ultrasound-guided access to the renal pelvis wearing the headset. You can observe the clinician holding the biopsy gun and his hands still, which are facilitated by the headset. For the renal access procedure, the clinician passes the needle into the collecting system, which appears here to be dilated. This is a consequence of filling of the ureteral access point, which allows for placement of additional irrigant or fluid or the passage of a ureteroscope into the collecting system. One can also note just above the tip of the needle as it enters the collecting system the acoustic shadowing from the renal stone. The headset tremendously facilitates the clinician to look at his hands while doing the procedure, which helps him guide both the needle and hold the probe still. A complete percutaneous nephrolithotripsy is performed on a prior version of the Phantom. The Phantom is set up under the image intensifier. and renal access is obtained and confirmed by passage of contrast into the collecting system, which allows visualization of the pelvis and proximal ureter. Following proper placement of the access needle, a guide wire is passed into the collecting system, and this is followed by serial dilators and the sheath, which then allows placement of the nephroscope so the clinician can visualize the interior of the collecting system of the Phantom. The collecting system is visualized, as is a kidney stone. The ultrasonic lithotrip is introduced, and the kidney stone is broken up and aspirated. The entire procedure can be completed very similar to what's done in a patient. The Viomerse Kidney Pathology Phantom permits training in multiple procedures. The headset can be used as an accessory monitor, allowing see-through vision, and functions as a remote training tool where both proctor and student communicate using line-of-sight technology.